Thank you. All right. All right, good morning, everyone, and Happy New Year. We are here. It is Wednesday, January 4th, 11 a.m., conference room 323, and we're here for a joint informational briefing of the committees on Energy and Environmental Protection and the Committee on Agriculture and the Environment on the findings and recommendations of the cesspool conversion working group. This is a working group that has been ongoing for, I think, almost 4 years. I've been a part of that as well, so it's been a lot of work. I know firsthand how much work went into it. And this is a hugely important issue that we need to start moving forward with some concrete action on, so we're looking forward to hearing and educating everyone about what those recommendations are. I'm Nicole Lowen. I chair the Committee on Energy and Environmental Protection. I'll introduce House members really quickly and then turn it over to Senator Gabbard to introduce Senate members. This is my new vice chair, Ellie Cochran from Maui.
Aloha, good morning. Thanks for being here.
And then we're joined by committee members, Rep. Caruso and Rep. Woodson, also from Maui.
Morning.
And then some additional House members are joining us today who are interested in this issue. So we have Representative Tarnas, Representative Martin, and Representative Matayoshi. And over to you.
And for the Senate, I'm Mike Gabbard, chairing the Agriculture Environment Committee. And with me today are Senator Awa, members of the committee, Senator Awa and DeCoit and Rhodes. And I wanted to thank the presenters as well as the working group for all of your hard work on this crappy issue. And thank you. Aloha.
Great, and then we'll turn it over just directly to Sina, who I think is going to kind of MC all the presenters. So over to you, Sina, from Department of Health.
Okay, so good morning, Chair Lowen, Chair Gabbard, and committee members. I'm Sina Pruder, Engineering Program with the Wastewater Branch of the Department of Health, and I was just one of the cesspool conversion working group members. The purpose of this briefing is to discuss the findings and recommendations from our group. And before I actually start my presentation, I would like to introduce the other presenters at this time. So Dr. Roger Babcock. Dr. Babcock is the Director of the Environmental Services, City and County of Honolulu. He's going to be talking about the technical research that we did on the different types of wastewater systems and technologies that we looked at during our 4-year period in the cesspool working group. The next presenter is going to be Dr. Carrie Ishida, and she's with Corolla Engineers. So she was, she works for the consulting group that we contracted, and she's going to be talking about the finance research for cesspool upgrades. And then our other speaker is Dr. Christopher Schuler, and he works for the University of Hawaii, and he'll be talking about the data and prioritization for cesspool upgrades. And our last speaker is Ted Bowen. He's a retired state employee with the Department of Attorney General's office, and he's also a cesspool working group member. So I'll just start. So this is the agenda for today's discussion. I'll be talking about the background and overview, and then we'll be talking about the technology, study, research, finance, data and prioritization, and then our final report recommendations. This is just a background and overview of how our cesspool conversion working group was established. What is that? It was actually established based on Act 132 of Session Law 2, 2018. And the purpose of this group was actually to develop a long-range comprehensive plan for cesspool conversion statewide by 2050. And we spent about 4 years, trying to tackle this issue with the first meeting held like in September of 2018. And these are just a list of our working group members. So we actually had like a lot of stakeholders involved with, trying to find solutions for cesspool upgrades. And this is like a list of them. And we have some of them that's in the audience today. That's Stuart Coleman, he's Y. And we have Ramsey Mansour. He's the director of the County of Hawaii Department of Environmental Management. Okay. And I think that was it. And this is just the rest of our working group members. And I also want to acknowledge Kristen Reynolds, our facilitator for 4 years with One World, One Water. She kind of helped us. It's really important to have a facilitator when you have like a lot of people in a group to try to manage a group and try to keep things like to the agenda. So yeah, that was like a really big help. Okay, so Act 132 objectives. So part of the cesspool working group was that we had like 15 different objectives that we had to evaluate. And what we did as a group was we looked at them, and a lot of them were duplicates of and overlapping of, you know, what was like the important part of trying to evaluate cesspool upgrades. So what we did was we took the 15 objectives and then we kind of put them into categories of finance. And finance is a big issue because how are we going to fund these cesspool upgrades? You know, and one of the questions was, who is it affordable? Who can actually afford cesspool upgrades? That was kind of important to know, you know, to evaluate like who can afford it, you know, because if we're requiring people to upgrade, like what is the percentage of the homeowners that have it and what is their income level of, you know, can they afford it? Are we pushing on something? And, you know, and if it's not affordable, what are we going to do to help, you know, subsidize, you know, the upgrades? And another topic that we looked at was technology. You know, what are the existing technologies that exist for cesspool upgrades? And again, tying back to finance, you know, are there affordable solutions for, you know, for finding like technologies where you can replace a cesspool? And the third area that we looked at was data prioritization. And that is actually kind of important because, you know, I think, you know, part of the 15 objectives was, one of it was trying to evaluate the 2017 prioritization that the Department of Health did. So this data prioritization actually did a deeper dig in evaluating, you know, getting more data, you know, and how, you know, determining what cesspools actually impact, you know, our drinking water and our other, like our recreational waters, you know. So there were actually a lot more factors and studies done for the data prioritization. And so the working group members, we were able to contract Corolla engineers, and they did both the finance and technology studies, you know, to help us with these objectives. And then we also contracted the University of Hawaii, and they actually provided us the information on the data prioritization report. Okay, at this time, I'm going to have Dr. Babcock provide his presentation.
It's going to work. Okay, thanks, Sina, and good morning, everyone. Thanks for being here. We've been working on this for quite some time. The work I'm going to present was completed in 2020. As Sina mentioned, it was contracted through the consultant, but then they contracted us at the University of Hawaii. I was at the University of Hawaii at that time. I just joined the city 2 years ago. And so the part we did was really consisted of 4 sort of pieces. One of the first things we did was to evaluate how other states approve alternative technologies. The way on-site systems work in Hawaii now is that the State Department of Health wastewater branch approves any new on-site system. And basically, they have rules that apply. And if you want to put in a septic tank, there's rules and guidelines that tell the engineer exactly what they have to do. If you want to put in an aerobic treatment unit, which is a higher technology, then you can get processes pre-approved by the State Department of Health. Anything else is a one-off evaluation of an engineering report, and it's a fairly long process where the State Department of Health has to validate and approve of a system. So this first exercise was to figure out what other states are doing to approve other technologies, and so the Department of Health wants to put in place ways to be able to do that effectively. The second task was to look at review how septic tanks work and what their applicability would be as part of the overall cesspool conversions. How many things, where a cesspool is going to be, or septic tank is going to be appropriate. Then we did an overall technology evaluation of essentially alternative technologies, all the things that are out there, what's going to be approved and what are their relative costs. And then the last piece that we did, there was the 4 pieces, was small, what we call cluster systems. So instead of large centralized wastewater plants like we mostly have here in Honolulu and throughout the state, these would be smaller cluster systems, meaning there's 10 to 100 homes involved. And they would have their own small sort of regional treatment. We call that decentralized treatment. So I'm going to try to make this work here. Okay, so this is sort of an agenda of the different pieces: the on-site wastewater treatment system evaluation, the decentralized systems, some of the lessons learned from other states, and the findings and recommendations. A little bit of an introduction. So with respect to converting a cesspool, which are now banned effectively by 2050, they need to all be replaced, there are some options. One is connection to an existing or a new sewer system, part of the centralized system, and some that's going to be applicable to. Connection to an existing or new decentralized system. These are the cluster systems that I mentioned. And then there would be converting, essentially upgrading an on-site system on individual properties. So those are kind of your basic three options. And just so you know, the one connection to an existing sewer system, here at City and County of Honolulu, we have a large project that's completed design for Eva Beach. There's about 500 cesspools. We'll be putting in sewers and connecting all those. We have $50 million in FY24 budget for that project to get completed. So that's the conversion option. It's very expensive. You have to have a treatment plant to send it to. It's putting in a lot of pipes and stuff like that.
Who pays for that? Is that the city?
That's the City and County of Honolulu. Yeah.
That pays for all of
Yeah.
it?
Yeah. That project. Okay. Treatment and disposal technologies. So, as I mentioned, there are certain things that are approved already. So this is kind of a list. Septic tanks are approved, and there's rules specifying how you size them. Aerobic treatment units with nitrification and or denitrification, these are approved on an individual basis by the per technology or per manufacturer. Those have to get approved. They're not all approved blanket, but specific ones that have been through testing and have been validated are approved. Chlorine disinfection is approved. UV disinfection, so these are additional treatments that go on the end prior to discharge or into the ground. Recirculating sand filters, approval is required. And then other ones in here, one called Eliminite, Nitrex, and recirculating gravifilter system that's approved in Washington. These are considered emerging technologies, and they are they're not approved, so it would require approval to be used in the state. So we end up with different components. There's a treatment unit, which you think of a septic tank, and then there's a absorption bed, or often called a leach field. So that's a disposal. So we have treatment and disposal. So this is treatment. Here's disposal technologies that are approved: an absorption bed, also known as a leach field, a seepage pit, which is kind of a converted cesspool. It's still a hole in the ground where you put now treated water instead of untreated water. I don't know if we mentioned before, but I think everybody knows a cesspool is untreated raw wastewater goes into a hole for dispersal. The other thing that's approved is Presby systems, which is called Advanced Enviroseptic, which is actually a type of absorption bed which provides additional treatment and disposal at the same time. Approval is required if you want to do evapotranspiration. That's a zero discharge system where you evaporate all of the effluent and it doesn't infiltrate into the ground. Constructed wetlands also require approval. Drip irrigation can be approved. And then we listed a couple other things: passive treatment units, layered soil systems that are either innovative or emerging. And we don't really have that first thing that I mentioned about figuring out how other states approve these kind of technologies is what is needed, because it would be a different sort of approval process than what DOH usually does to approve an aerobic treatment unit, which is what they currently are able to do. So we used some evaluation criteria, the type of technology and its approval status, what various siting restrictions there are, the performance, how often you have to replace it, and how much it costs to operate it, and then benefits and challenges to implementation. So there's a lot. It's a fairly large document. It's in one of the appendices or in part of the report. But basically, we kind of came up with what are the most likely conversion options there's many different perturbations and iterations that you can have, all of those different treatment technologies combined with all those different disposal technologies, but some are much more likely than others, and those are what's shown here. We split it up into typical site conditions versus constrained site. Constrained could be due to either slope, size, or proximity to a water body, or proximity to groundwater. Those would be constrained sites. Typical sites are where you don't have a lot of difficulties like that. So in typical site conditions, septic tank plus an absorption bed is going to be generally the most typical and least cost option. Another option would be a septic tank plus the Presby system, which is a type of absorption bed which also provides additional treatment, or an aerobic treatment unit, that's what ATU stands for, plus an absorption bed. And again, an absorption bed is another name for a leach field. A lot of people call it a leach field. But just so you know, an absorption bed is a more accurate name for it because it actually does do treatment, the absorption bed. It's shallow, and so it's aerobic, so it gets air from the atmosphere, it's oxygen from the atmosphere, and so bacteria live in there, and it does provide treatment after the septic tank during the dispersal process. Another typical one would be a aerobic treatment unit with NDN, which means nitrification and denitrification, which removes nitrogen, which would usually be nitrate that would diffuse into the ground and goes into groundwater. It isn't absorbed. It transports with water. Or a septic tank plus a modified absorption bed, like what's called a layer cake, which has a denitrifying layer built into it. And this is becoming fairly common in some New England states where it was sort of pioneered. And another option would be a wetland. For a more constrained site, if it's area constrained, a septic tank plus a seepage pit, which would be a converted cesspool, cleaned out, repurposed, and used then for infiltration, is applicable. But if there's room for an absorption bed, the DOH is generally going to require you to do that and not use a seepage pit. If you need further treatment, you can do a little bit greater amount of treatment. You use an aerobic treatment unit plus a seepage pit. And if you require nitrogen removal, you would use the ATU NDN plus disinfection. So in that case, that would be for places where you're on the coast, close to water, or even right in groundwater. So you really need fully treated water, essentially what we're required to do at the city at a centralized treatment plant. Primary treatment, secondary treatment, disinfection before discharging. So that's what that last one is. Okay, a little bit about the cluster systems, decentralized systems. So what we looked at was 10 to 100 homes, as I mentioned, which equates to about 5,000 to 50,000 gallons per day. These are basically package plants, is a word that's used in the industry. So there are pre-engineered, ready to operate. Plug in, put plumbing in, and it'll work. It'll run at the capacity that that it's rated for and sold for. So there isn't any engineering design or anything that happens, right? You're purchasing a ready-to-go unit, and that's very, can be very cost-effective. So things to consider with a cluster system, there are some big challenges associated with doing a cluster system. It's going to depend on sort of the proximity of the cesspools. If you have to have, if they're large separation or large distances from a central location where you can locate this treatment unit, then that's going to be a big challenge. Terrain, hills that if you may have to go over and under are an issue. You have to have a site for this, so you have to have some commonly owned land. Land's very expensive, so that is a major constraint. And then, of course, you have to have public support. So the folks that have the cesspools to hook up to the system have to all agree. They got to fund it, and then they also have to upfront as well as operation and maintenance, essentially in perpetuity. So that's can be a challenge. As part of that, there's actually three components. You got to have a collection system. You got to get the wastewater from the homes to the decentralized system, and then you also have to have a treatment plant there, and then you have to have a disposal unit. So compared to the on-site, which just had treatment and disposal, this adds collection. Right? You have to have a collection system, which is pipes in the ground, and you got to figure out a place to put those. So with respect to collection, you can have a gravity sewer system. You can have what's called a liquid-only pressurized sewer system, and you can have low pressure systems, and you can have vacuum systems. We have a lot in the city's system. We have a lot of gravity sewers. We have some low pressure sewers, most notably out in Laie, where there's about 750 of them, and there's a few other places where we have those too. That's essentially a low pressure system, and we currently don't have any vacuum systems, but those are applicable. So we evaluated the different collection systems, treatment system operations. These are different names of different types of treatment systems for essentially biological wastewater treatment, activated sludge, memory bioreactor, which is another type of activated sludge. There's these textile filters, which is also a biological process, and there's a couple others there, including a constructed wetland. So these are the group of treatment systems that are essentially possible in a cluster type system, a decentralized small wastewater treatment plant. And they can be packaged as units. In terms of effluent disposal, it's another component that needs to be considered. One would be an absorption bed, same as if you're doing a septic tank. We can have drip irrigation. We can have low pressure underground system. We can have seepage pits. You can reuse the water as well as another option, and you can also do evapotranspiration, zero discharge. In italics is shown there injection well and surface water discharge, because those would require additional permits and would be very, very challenging. But they're there for sort of completeness of the evaluation. So this is a list of some of the benefits and challenges of decentralized system. I think some of this was already went over, but this is just to kind of summarize for this decentralized cluster systems. Could potentially be rapid, because you could be doing 10 to 100 units at once, cesspools, as opposed to one at a time at each individual home. They would be reduced administrative oversight, because if it's one cluster, it's kind of evaluated as one thing, as opposed to 100 different houses that would have to somehow be managed by Department of Health or somebody else. There could be a reduced burden, because it would be sort of centralizing 50 homes with one engineer doing the work, as opposed to 50 different contracts. You can also, one of the requirements for these systems is it falls in the same category as a large centralized wastewater treatment plant. By law, it has to be operated by a certified operator, whereas an individual on-site system does not. There's no specialized license or personnel required to maintain those systems. And there could be some other additional funding opportunities for these group systems as opposed to individual. The challenges, of course, is that you have to have cooperation among the folks that are going to connect to the system. In general, it's a higher cost, because you have to have a collection system primarily. That's the main big difference, is that you got to install pipes somewhere and get right-of-ways and install all those things, and then you got to maintain them also forever. And you do have to have the operators, and you need to have some land. And land is expensive and difficult to come by. Okay, so I'm going to move then now to the summary of findings and recommendations. So this is really the only thing that's in here about the septic tanks. Septic tanks is a proven technology, it's been around for a really long time. One of the issues that is sort of unknown is about sort of the density. If we're to replace tens of thousands of cesspools with septic tanks, the question is, at what density does that become sort of problematic? And we don't necessarily have an answer for that, but it still needs to be evaluated, especially with nitrogen, because they do discharge nitrogen, which would impact groundwater. Further, there was a need to develop a coordinated strategy for the methods used to do the conversions. And one of the recommendations that's in the report, there's a lot of recommendations. One is that the counties are responsible for doing something at the county level and coming up with their plans, as opposed to just the state somehow coming up with a plan that applies to everybody. We need to know questions like which one, what's the possibility of using existing sewers? What's the possibility of expanding sewers? And the feasibility of site-specific feasibility of these decentralized systems. And so we've made some effort, some progress in some of these areas, but these are more localized issues that need to be addressed, as opposed to sort of statewide issues. So what works in Eva Beach doesn't work in Kahaluu and in Laie and all over, and then statewide, right? Every neighborhood and community and district is different. So there's going to have to be quite a bit of local work. Here's kind of a fairly long list of what was learned from establishing a process to approve alternative technologies in Hawaii, learned from the other states. I'm not necessarily going to read through all this, but basically these are some of the things to make a successful sort of approval program. You got to have staff, and you're going to want to do some other best practices that are listed here to be able to have an effective program. A little bit more about that, and this is more overall staffing, training, workforce development, and some progress has been made in this area too. But one thing is the Department of Health wastewater branch is charged with essentially overseeing all of the on-site systems statewide, and so if we have 83,000 additional new individual on-site systems, how's that going to be managed? Definitely there's going to be some additional staffing needed to do that. Because if you think about operating all these systems, you'd need to have a system somewhat similar to what we have for our wastewater treatment plants, which is there's a permit, it has to be renewed every few years, there's fees that need to be collected, it needs to be inspected prior to the permit being renewed, and generally on an annual or semi-annual basis to make sure things are actually working, right? And so there are staffing requirements, to do that. And right now there's only a lot less than 100 wastewater treatment plants that CENA has to inspect, but this would add many thousands potentially of having. So there's staffing needs there. We do need contractors to be able to install all of these. There are contractors on every island, but they can't necessarily immediately start installing thousands per year of cesspools. They don't have the workforce for that, the technical workforce, or engineers to design it right now either. And then we have to have operators who would operate, inspect, maintain, and operate these systems. And we currently have a large shortage of operators statewide in our centralized treatment plants. Last thing here, I think, is public outreach and education. So there is a big need to get the word out about this issue and about what the options are and about what it's going to cost and all those kind of things. The workforce, there are some efforts going on with workforce. Stuart is here, Vi is doing some stuff with that, and they have some grants to look at workforce development. I think the next thing, yes, the next thing we're going to talk about is the financing studies that Carrie did. And I guess, Rep. Lowen, we're just going to do questions at the end?
We'll
or-
do questions at the end,
Yeah,
just so we
okay.
can get through everybody.
Thank you.
Thank you.
Okay, sure. Good morning. Thank you all for your time and attention. My name's Carrie Ishida. I'm with Corolla Engineers. I have the tough news on the finance piece here to share with you. So with that, here's a quick agenda of what I'll be going through. I'll talk about the affordability analysis that we completed, talk about some of the funding options that we looked at. There's also some factors that do affect cesspool conversion as a program, and then I'll summarize our findings and recommendations. So I just want to quickly acknowledge the team that supported all of this work, both the technologies and the finance work, experts that have expertise in funding and affordability for water and wastewater systems across the country. So thank you to those that helped with this project. Okay, so the affordability analysis, I'm going to talk you through our methodology here. So we had data sources, costs, and affordability measures. So ultimately, you wanted to compare the costs to what is considered affordable and try to define that. So for data sources, we looked at geographic information systems or mapping tools that are available. So looking at the different cesspool locations. We also looked at median household income, or MHI, at the census block group level. And then we looked at the priority areas. I do want to let you know that we looked at the 2018 priority areas. Dr. Schuler is going to talk about the updated priority areas. So some of this is a little bit dated, but keep that in mind. As far as the installation costs, we got that from a Department of Health database of costs that they had on file for conversions at the individual household level. So not the decentralized and centralized options that Dr. Babcock had gone through. We were focused on the individual household level. We also looked at operations and maintenance costs, so the ongoing monthly cost to operate and maintain these systems, or O&M costs. For the affordability measures, we looked at 3 different things. We compared it to the average sewer bill. We also looked at the percent of the median household income. I'll talk a little bit more about these measures in a minute. And then we also looked at the federal poverty levels. So as far as the cost and financial impact of cesspool conversions, we looked at 3 different scenarios: low, average, and a high cost scenario. So I do want to emphasize that these costs are very site specific. As Dr. Babcock had gone through, it really depends on the lay of the land, depths of the groundwater, what have you. So the cost can be even more than the high cost scenario that we're showing here, the $38,000. But we had to, give some structure to this evaluation. So we looked at, this is the total conversion cost, the construction cost, those 3 scenarios, $10,000 ranging to $38,000. And then we tried to kind of finance that and get it to a monthly cost. So you applying an interest rate of 4% over a loan term of 20 years. That gets you to an average monthly cost ranging from $61 at the low cost scenario to $230 at the high cost scenario. Let me back up a second and talk a little bit more about the low, average, and high cost scenarios. So the high represents the higher level of treatment options that Dr. Babcock had presented, and it can be even higher, as I had mentioned. The low cost scenario is really the most simplest, straightforward conversion, whereas the average is more kind of, the average conversion, not too complex. Then we had the different monthly costs for operations and maintenance, ranging from $33 per month to $108 per month. So that's things like, energy. Some of these systems might require energy or other maintenance. That gets you to a total estimated monthly cost for each system. So $94 per month. The average is $210 per month, and then the high cost scenario was $339 per month. Now keep in mind these are all $20. So as far as the affordability measures, we looked at the federal poverty level. So that was an annual income of less than $30,718. We also looked at the percent of median household income. So by that measure, which is commonly applied to water and wastewater utility affordability evaluations, you're considered financially burdened if the conversion cost is greater than 2% of the median household income. So backing up to that other slide where we had showed the monthly costs, comparing that to your income. Now that threshold, if you have an annual income of less than $126,125, you're financially burdened by these cesspool conversion costs. Okay, now I'm going to walk you through some of the affordability results. Let me orient you to this graph right here. This is a histogram plot with all the statewide cesspool counts, and on the y-axis. The x-axis shows different bins of median household incomes. So this lower end, you can see my pointer, shows how many cesspool owners are within those income levels. The higher end shows how many cesspool owners are in those levels, so on and so forth. There's different color bars for each county. Hawaii County is shown in blue. City and County of Honolulu is shown in orange. The County of Kauai is shown in gray, and the County of Maui is shown in yellow. Let's walk through this. So we looked at the federal poverty level that's shown in this dashed line. So everyone to the left of that line is going to be really hard pressed to do these conversions. Their annual income is below the federal poverty level. That's roughly 5% of all the cesspool owners. This next dashed line, that's the 2% median household income level. So that's the affordability threshold that we had defined. That represents roughly 94% of the cesspool owners that would be financially burdened by the conversions. Now we did take a look at sort of an intermediate scenario if a $10,000 rebate were to be provided to see how that would shift the line. It does shift the line to the left, but still 82% of cesspool owners would be financially burdened by the conversions, even with that $10,000 offset. Okay? So here's the comparison to the typical monthly sewer bill for the different counties. So I'm showing as the dashed lines the low, average, and high cost scenarios for the cesspool conversions, and then the bars represent the average sewer bills. Now I do want to, say that these monthly sewer bills are not representative of all the costs that the counties bear to operate, maintain, build their sewers, but this is something that homeowners will look at when they're thinking about these conversions, right? So you can see that the low cost scenario, there are average sewer bills that are much lower than even that. Okay, now I'm going to step through a series of maps for each county with the affordability results. And I will, I had mentioned that the prioritizations are being looked at by Dr. Schuler, so what's shown in these maps are dated. It's the 2018 prioritization, so Dr. Schuler will update you on that. But this is sort of a heat map showing the median household income level in the different colors. So the browns to the yellows are kind of the lower end of the incomes, and the greens to the blues are the higher income levels. So you can see that Hawaii County has the greatest affordability challenge, with 98% of cesspool owners being financially burdened by conversions. They also have the most cesspools of all counties. And this last bullet here, they have the least access to centralized sewers. 71% of the county is without access to a centralized sewer. Now that means that their most likely conversion option is either the cluster option that Dr. Babcock had gone through, or at the individual household level. So they cannot connect to a centralized sewer unless it's built, which is also very expensive. Okay, in contrast, the city and county of Honolulu has the most access to centralized sewers, with the lowest percentage of households with cesspools at 3%. They are, on average, the most affluent of all counties, but there is also significant poverty, and you can see that in this heat map as well. Moving over to Kauai County, 95% of cesspool owners cannot afford the conversions. There are 54% of all households that have cesspools. So they're kind of in the middle between Hawaii County and Honolulu. Last but not least, Maui County, 22% of households have cesspools, and 98% of Maui and 100% of Molokai residents cannot afford the conversions. Okay, let's talk about the funding options. So there are a lot of challenges to implementing a funding program. As you can see from all the results for the different counties, there isn't a one-size-fits-all solution. And as we just walked through, there's quite a large magnitude as far as the affordability issue. Another challenge is homeowners do need incentives to convert their cesspools. Part of that is some of this outreach efforts to identify and quantify the benefits, whether it's environmental or water quality. And so there is a need for extensive and sustainable public outreach. There's also a need for upfront costs, things like costs to fund a program development, administrative costs to add staff to manage this type of a program, and homeowners have a lot of upfront costs, to hire an engineer or a contractor that, to get the permitting done. There's upfront costs that they might not, it's hard to fund in the rears. It's also important to consider the funding recipient. Some of these funds, it's difficult to get into the hands of the homeowners. There's a need for what we call conduit agencies, or kind of middle parties that can receive the funds from the source, but then ultimately get it to the hands of the homeowners who need it. So there's a need for considering that funding recipient and this middle party, these conduit agencies. Also, the funds need to potentially fund a variety of conversion options, right? So either connecting to a centralized sewer, if that's an option, building these cluster systems, or an individual wastewater system. So those are very different options to fund. And there needs to be legislation and a governance structure for this. Okay, so let's talk about the different funding sources. This shape of this pie is misleading. It's not all equal, but just some of the different funding sources we looked at: federal grants and loans, the state Clean Water State Revolving Fund, property assessments, some others where there's nonprofits, rebates, rebate programs, or private financing, which is taking out a second mortgage for a home improvement loan, something like that through the banks. Okay, so this is a hypothetical funding scenario to try to help get our arms around what's the potential funding gap, because there is a funding gap. So estimating the total conversion cost for all cesspools at $2 billion, that's taking the average cost to convert, applying it to all cesspools. And let's just say, hypothetically, that $5 million a year can be obtained through the Clean Water State Revolving Fund. Let's say, hypothetically, that about $1 million a year can be obtained through federal grants and loans. And let's say there's a state rebate program at $10,000 for those that are below the federal poverty level. And then lastly, let's say that some homeowners that can afford the conversion, but through financing through private banks, they're able to do that, right? So that still leaves us with just over $1 billion in a funding gap to convert all these cesspools. Again, this is just hypothetical. We're just trying to get our arms around that potential funding gap. So just to summarize some of the key takeaways, similar to what Roger Babcock had shared, we looked at what other states had looked at for funding and finance needs. So certainly we could see the large magnitude of the funding that's needed versus the available funds. There's also a need for sustainable financing mechanisms to cover program administration and other costs. We did see that other states with successful programs had a suite or portfolio of funding options. They also had early and extensive public outreach and education. It's really, really important to share with the public their options, help them on the finance side, how do they do this? Other states also helped to pay for conversions through low interest loans, and there were conduit agencies, these pass-through agencies that could help get the funds from the source into the hands of the homeowners. Okay, so factors that do affect cesspool conversion programs. Again, this public education piece is very important. They need to know the methods of conversion. They need to know the technical and financial resources. There's also this perception of inequity that needs to be addressed. We talked about there's very site-specific costs, but it's to be providing different levels of aid to defray these different costs that can be really challenging. And then, being aware that these cesspool owners may compare these costs to the sewer fees, and it's not really a fair comparison. There also needs to be some near-term incentives to convert in order to meet even the 2050 deadline. Dr. Schuler is going to present some different information in just a bit, but even to meet the 2050 deadline, there's an aggressive pace of conversion that needs to happen. And there needs to be a focus on the priority areas. As Dr. Babcock had pointed out, there's an issue with workforce. There's a need for professionals, contractors, and those that can operate and maintain these systems. There also needs to be a responsible management entity. It can be a single management entity, but it needs to be long-term, as this program will need to be long-term. There needs to be a stable source of revenue to support the program funding and the ongoing administrative costs. Just to summarize the findings and recommendations. So clearly we saw there's a large burden of affordability for these conversions. There's also a large funding gap. There needs to be a coordination of legislative efforts. And we need to identify viable financing mechanisms. There's different funding options, but there's all different ways to fund this. There also needs to be an identification of administrative resources and an addition of administrative resources. There needs to be coordination with and leveraging of federal, state, and local entities. And then there needs to be a way to determine the distribution of the financial aid. I guess before I close, I did want to share a little bit of good news. That was some tough news. That there are opportunities to seek out grant programs. We're in the process of obtaining a very small grant to do a demonstration of a decentralized cluster system. So things like more projects like that are definitely needed. So with that, thank you for your time.
Thank you so much. And then I think next we have Dr. Schuler from UH Manoa, I believe, to talk about the prioritization study.
Thanks, Carrie, Dr. Babcock, Sina. Everybody, thank you so much for being here and for the opportunity to open this discussion on this very important topic. I'm Christopher Schuler. I'm a research hydrologist at the Water Resources Research Center and affiliate researcher with the Sea Grant program at University of Hawaii. And I'll talk a little bit about, for us, what was kind of a project that was funded by the Department of Health and the cesspool working group directly to really put all of the data that we have available in the hands of the Department of Health and the working group and the public and our state in order to understand how these cesspools affect human health and the environment. Before I get going any farther, I do want to acknowledge my co-author on this work, Michael Mezzacapo. He was really a co-pilot, is still a co-pilot on this work, but he actually recently moved up to a job in the US EPA wastewater division at Washington, D.C., so our team's moving places, shaking and moving. And then I also want to acknowledge Department of Health, Water Resources Research Center, Sea Grant program. They have been supporting this and addressing water-related issues to cesspools for a long time. And then finally, I want to also acknowledge we got a lot of really great student help from graduate students, undergraduates at the university, and their energy was essential to make this work possible. So I'll start off with a little bit of the motivation behind what we were trying to get at with this prioritization. I don't think I need to tell anybody in this room that there's a lot of cesspools and it's a really big problem. There's lots of nitrogen and lots of phosphorus being dumped into our coastal oceans every day. And then, just as my fellow presenters have mentioned, really at this point there's not the capacity in the state, even if we had all of the financing, to replace all of these cesspools all at once. So this demands a stepwise approach, and as with any good triage, prioritization is really key. So in 2017, 2018, the Department of Health did a preliminary prioritization assessment and put together some priority areas as priorities 1, 2, and 3. But this assessment actually left out a good amount of the cesspools in the state. So all cesspools were not categorized, and this approach was limited in the amount of data that was available. So for our project, we intended to build upon not necessarily replace, but build upon that previous prioritization, and to rank as many of Hawaii's cesspools as possible with the data sets that we had available, based on their individual and collective impact to human health and the environment. So kind of the specific objectives of the project were first to identify all of the factors or data sets that could inform this prioritization, essentially all of the factors that impact human health and the environment. To categorize those previously uncategorized cesspools, which was a significant number. They used to be priority level 4. This new assessment does not have really any uncategorized cesspools, unfortunately, except as you see in number 4 there, the island of Molokai and Lanai weren't included because we didn't have those data sets, so we did focus on the 4 main Hawaiian islands. Throughout the whole project, we worked really closely with the cesspool working group, Department of Health to inform our methodology, and to help make all of the little decisions about how we analyzed these data. And really
Sorry, can you
Oh.
move a little closer to the mic?
Oh,
I think your
thanks,
voice
yeah.
is just a little soft and might
Thanks,
help
okay.
everyone
Can you hear me
you.
now? Better?
Yes,
Okay.
thank you.
Thanks. So, yeah, then really the meat of the project was to develop this scientifically unbiased, objective framework to rank all of the cesspools on the 4 main Hawaiian islands. So there weren't kind of personal decisions being made. This was doing this in a unbiased, completely open data kind of way. And on those lines, we also, good science doesn't mean anything if it's in a vacuum. So we're also continuing to work closely with the Department of Health to present these results as publicly available web applications, maps, and doing outreach so that this information is fully available to the public and to decision makers. So I'll go through kind of a little bit of the process of how we ranked all of the 4 main Hawaiian Island cesspools into a 1, 2, 3 priority ranking level. We started by doing our research, looking at how other states had done similar things, and we chose a simplified geospatial hazard-based model, essentially to integrate a large amount of data into any location, any point location on a map, represented by the 88,000 cesspools in our inventory. So the first step was to update the statewide cesspool inventory, taking in the new data that was available since it had last been inventoried by Bob Whittier in 2009. Then we curated all of those risk factors I was talking about. So these are the data sets that we used that we could find that had at least 90% spatial coverage over the state. And we looked at these factors. So that's things like distance to the coastline, streams and wetlands, distance to drinking water wells, and if cesspools were located within the well capture zones. We also looked at sea level rise zones and assessed whether cesspools were located in those zones or were going to be affected by groundwater inundation from below. We looked at the average precipitation, things like depth of the groundwater and the density of cesspools and the soil characteristics. And we also used groundwater models developed by the Department of Health to assess where the effluent from all of the cesspools in the state would flow to on the coastline so that we were able to associate coastal impacts or coastal resources, things like the coral cover or fish resources, to the actual effluent of each of the individual cesspools. We also used crowdsourced data from a photo sharing app to assess how used the coastline was by pretty much everybody who posts on the internet. And then we assessed the impact to lifeguarded beaches and then also coastal circulation. So those are all the data sets that go into this reproducible, scientifically objective, code-based framework. We essentially coded it up in Python using Jupyter notebooks based on the ArcGIS platform. And everything, all of the code, all of the data is publicly available on GitHub, which is a popular data repository on the internet. Anybody can look it up right now. And that framework, what it essentially does is it looks at the location of the individual cesspool, so this is Eastern Kauai, and just gives a score based on each of those 15 metrics. So this is the distance to the coastline. So the coastline's here. As you can see, the cesspools that are farther from the coast have a lower distance to coastline score. The ones that are closer have a higher distance to coastline score. We did that for all of those 15 factors. We also weighted each of those factors because all of them aren't of the same importance. And we had a hard time, coming up with this. It's kind of a value-based proposition to say which of these factors are more important. So the way that we determined that would be as objective as possible was to convene a panel of experts, and we hosted a number of workshops where we had those experts help us weight each of the factors, and these are histograms of that information. This is all described in more in-depth in our reports that are posted on the cesspool working group website on Department of Health servers. So with taking all of that information, all those data sets, all of the weights from the experts, and incorporating it into essentially one big geospatial calculator, we were able to come up with a single number for each of the cesspools in Hawaii relating to their impact to those 15 important factors. We also simplified this too because there's 88,000 things to prioritize. So we had to simplify that down into areas that could be managed. And we chose, with the help of Department of Health, census tracts. So we took the 103 census tracts that are across the 4 main Hawaiian islands, and we essentially just averaged those risk scores for each of the individual cesspools. And so the cesspools then were put into a categorization of priority 1, 2, or 3, all within their census tract. So here are the prioritization results statewide. Priority 1 cesspools we considered to have the greatest hazard. Priority 2 cesspools, a significant hazard. And priority 3, a pronounced hazard, since essentially all cesspools still convey some hazard to parts of the environment or human health. And the way that we separated these categories out was really essentially management-based. We binned them based on their quartiles. So the top quartile were the most impactful. Middle quartile was, the second quartile was our medium category, and then the lower 2 quartiles were those priority 3 ones. And that was really just based on the numbers that Department of Health could work with. So we could bin these in any other way because all of the cesspools have a number that's ranked. But this made the number of units in each of these categories a manageable amount of units for a reasonable conversion strategy. So kind of to summarize that, these are kind of the key points. We used a site-based process to determine if a cesspool at any given location has a higher or lower potential to cause societal and environmental impacts. Bin those into categories, priorities 1, 2, and 3. And I do want to mention that this tool, it's merely a starting point for assessing hazard. And we think that this tool, it can't really say anything about timelines. It is developed specifically to support the development of a thorough and thoughtful cesspool conversion plan. So it's just a part of that. And I do want to mention too that new results, previous results can certainly coexist with this tool. And this tool was developed, that codable framework was developed to be updatable. So as new data sets, new information comes along, we are able to modify that when the time is right, when Department of Health is ready to update. And then I'll finally just say we also validated this tool. So if you notice, there's no water quality data that was used to construct the tool. The water quality data was used to validate the tool, and that's the algal results from Celia Smith's LIMU wastewater indicator study that I also worked on, that was funded by Act 132 in order to validate the results of this tool. And the priority areas compared fairly well with what we found in the LIMU data. And I think I still have a little bit of time, so I'll just kind of promote where you all can find the results. So these results are all completely accessible online at hawaiicesspooltool.org. So we're currently working with Department of Health to do some outreach projects, as I mentioned, and there's 2 applications. One of them is the input data tool, where you can look this up right now on your phone, on your computer, see all of those input data sets. Then you can click through to see the results. And I'll just give a little kind of summary of the results island-wide. So here are the priority zones. Those priority 1 areas are in red. Priority 3 areas are in yellow. Hawaii Island, 84% of their cesspools are in, that's 40,000 of them, are in priority 3 areas. Kind of a similar amount for Maui at 79%. Whereas Oahu, on the other hand, for reasons that Carrie described, has 64% of cesspools in priority 1. And then Kauai actually has most of their cesspools in priority 2. And again, you can go to hawaiicesspooltool.org to see the results of this assessment right there. And then our report is also on the Department of Health cesspool working group page, and that fully describes all the methods that we use to categorize these. And that's all I've got. Thank you very much for your time.
Thanks so much. And then, Sina, are you up next, or are we going to Ted? Okay, Ted Boland is going to present the final findings and recommendations of the cesspool conversion working group, kind of across all of these subtopics.
Hello,
and then
Chair.
we'll go to question and answer. So thank you. We're almost there.
Great. Hello, Chair Lowen, Chair Gabbard, and thank you, members of the committee, for your time and attention today. My name is Ted Boland. I was a Deputy Attorney General for 15 years representing the Department of Health on wastewater matters, so I got to spend a lot of time thinking about cesspools. The other speakers today have been kind of inputs to the report in the sense of explaining the prioritization methodology, financial support issues, technology, and other issues. I've been given the honor of trying to talk about the recommendations, which are sort of the bottom line of where this report goes to the legislature. Before I get into the specifics, just sort of to set the table, I think it's clear cesspools are substandard sewage disposal systems. They pose a threat to the environment and public health. Leaving the upgrades to 2050 would put us in a bad situation. We'd have supply bottlenecks, and we really wouldn't be able to do the job. The report says, quote, no benefits to human health or environment if homeowners wait or postpone until closer to 2050, which would be the natural tendency. It's like, let's put this off. If we wait till 2050, we're not going to get the job done. And we need to do the job. Pollution threats all the reefs in Hawaii and fresh water by 2050. And we depend on our reefs for our shoreline, for our economy, for our way of life in Hawaii. So it's very important that we undertake this process of upgrading cesspools now. And sea level rise, which is coming, is going to make it worse. We've got, when the sea level rises, that causes groundwater to rise. And when the groundwater rises, that's going to push some waste out of cesspools in some places. So that's an additional public health threat that's coming with sea level rise. I think we all understand that the cost of this upgrade is going to be huge. But we can't afford to not do the upgrades. So we've got to figure out how to pay for it in a reasonable way. Prioritizing the cesspools that present the greatest threat to the environment makes sense. And that's what they've done. Well, that's what we've done in the cesspool conversion working group, as Dr. Schuler just explained. Staggering which cesspools need to be upgraded first also makes sense. It spreads out the expense and enables us to do some at a time. Under our proposal, I think we've got 26,000 cesspools that would be upgraded in the next 13 years. My math says that's 2,000 cesspools a year, which is a big increase of where we are now. We need to take advantage of federal grants, low interest loans, tax credits, and other financial means to make this affordable, because it will be expensive and we can't ask the homeowners to take on all of this. So let's move on. Yeah, thank you, just do that, okay. So first area that Dr. Schuler just talked about, prioritization and timing. I think the main, probably the biggest recommendation from the cesspool conversion working group is to move up the deadline on some of the cesspools, as I've already referred. Replace the 2050 deadline with priority 1 cesspools converted by 2030. That's 13,800 of them. And priority 2 by 2035, another 12,000. So that's about 26,000, as I referred a moment ago. And then the rest, priority 3, most of the cesspools, I think it's 68%, would continue to be converted between 2035 and 2050. So we're moving up probably the 30% that is the most urgent in terms of the environment. And that's what I think the cesspool conversion working group has decided needs to be done. And we are urging the legislature to adopt legislation to require that. The other item in terms of prioritization and timing is to require a seller's disclosure form for any property sold that has a cesspool. If you are buying a piece of property and it has a cesspool and you're going to have to, under law, upgrade it in the next 30 years, you ought to know that. There are some disclosure forms buried in the paperwork, but a specific disclosure form, I think, would be a good idea for anybody who wants to know what their property risks are. In terms of finances, now this is the big area. As I said, if we know the certain areas are priority, how are we going to finance it? How are these people going to pay for it? One answer is federal money. We can do, there is a lot of new money available under statutes passed in the last couple of years. There are existing programs that have federal money as well. We need to do as much as we can to try to capture as much of that money to alleviate the burden on homeowners. So that's the first recommendation. We also will need state and county money. We need to move money from other sources and supplement money with dollars. We need to facilitate financing options for low and moderate income homeowners who will have an especially difficult time in affording the conversions. And then we need incentives for cesspool conversion for all homeowners, because even those who can afford, we want to get them to upgrade when they can. One proposal is to require upgrade on sale. That has met resistance from realtors, and but that is an item that's in the report with a dissenting opinion. And finally, on this sheet, enable nonprofits and community development financial institutions to help cesspool owners access available funding through the existing Clean Water State Revolving Fund. We get a lot of money from EPA through the Department of Health for Clean Water State Revolving Fund for loans, and we should enable others to access that and make it possible for more people to use that money. In terms of technology, the recommendations are the Department of Health should certify and adopt novel wastewater treatment and disposal technologies to address nutrient pollution reduction and public health protection. Nutrients are especially key. Cesspools put out pathogens which are dangerous to human health that go into the groundwater. They also put out nutrients which are dangerous to the environment. They cause algae growth and are very harmful to reefs. And they're not taken out by the traditional cesspool system. So we need systems that will reduce nutrients. I think Dr. Babcock referred to those briefly, but they're in the report as well. And then we need to develop and maintain a comprehensive resource of technology options, including the advantages and disadvantages. So people know what their options are and what they can do. And that is indicated here includes on-site systems, sewering systems, and cluster systems. And finally, update the minimum treatment standards, for example, the reduction of nutrients, for on-site wastewater technology, especially for ecologically sensitive areas. So we have work to do there in terms of our standards. Next is planning and program administration. We're going to need a lot of additional help in order to administer all of the programs that are coming down. The Department of Health has all of its people busy now, and if we add to their burdens with the upgrade of even 30,000 cesspools, we're going to need more people. The counties are going to have additional responsibility if they're building cluster systems. So there's a lot of work that will need to be done, and we will need more people for planning and program administration. A recommendation of the task force is to, of the working group, is to establish a cesspool section within the Hawaii Department of Health's wastewater branch to include at least 3 to 4 staffers to work on planning, implementation, permitting, and regulatory. And we need to increase our administrative capacity as needed for cesspool conversion on state lands, DHHL and other DLNR, other agencies. And finally, it's very important and a priority of EPA, I think, prioritize environmental justice principles for disadvantaged community needs so that there are equitable outcomes related to the entire cesspool conversion process. We will need to develop our workforce. We need to figure out what the needs are, and then we need to allocate funding to support existing programs or the creation of new workforce training programs such as education, certification, on-the-job training, partnerships with other agencies, et cetera. In this area, I'd like to ask Stuart Coleman if he'd mind giving us a few words. You want to take over and just give us a few words about this? Stuart's been working with the Workforce for Water program, and you want to come up?
Yeah, thank you, Good afternoon. My name is Stuart Coleman, and I'm on the cesspool conversion working group, as Ted mentioned. And I work for a nonprofit called VI, Wastewater Alternatives and Innovations. And we applied for federal funding to do workforce development training, and that was over a long process, over a year, approved through Senator Hirono's office. We're just finalizing it with Department of Labor, and so that will work with, as a pilot program, the community colleges, Hawaii Community College on the Big Island, and then Maui College on Maui, to set up the first kind of training programs. Dr. Roger Babcock runs the wastewater treatment operators program, but that's for like municipal large plants. There's not a training program for smaller, when we talk about the cluster systems or individual systems. And so we have 4 tracks that we're going to be training, but this is going to be like a wastewater 101, and we'll really try to help steer young people, displaced workers, and people from disadvantaged communities into these programs, because we've estimated that it could create, without a doubt, hundreds of jobs, but it could be up to a couple of thousand jobs eventually. Because right now we're converting about 150 to 200 cesspools per year. That rate needs to go up to a minimum of 3,000 per year to meet the mandate under Act 125. So exciting opportunities. This is the silver lining of this challenge that's facing Hawaii, and that these are green jobs. Some people might say brown jobs, but they're green jobs, and that they pay well and they're consistent, and you don't have the boom and bust cycles of tourism, for instance, or construction. It's very consistent work, and it's improving the environment, and most importantly, protecting our water quality. So I also want to mention the UHC grants program. They publish a magazine 2 times a year called Kapili Kai. The issue that's just coming out, and I think all of you have been invited, all the legislators were invited to this at the aquarium, Waikiki Aquarium, on January 17th. But this issue is 100% dedicated to wastewater issues. So it's a really valuable resource that I think we should all kind of turn to for that. But thank you for allowing me to present, Ted.
Thank you.
Thank you very much, Stuart. You did know so much more about that area than I do. It's great to hear about the green jobs. The last area on the report recommendations is outreach. Very important to reach out to the public so they know what's going on, educating homeowners on conversion options and resources. So those are the 6 areas of recommendations. I've sort of breezed through a summary for you today because there are about 26 recommendations, I think, in the report. They're right up front on pages 3 through 6, I believe, and you can read in more detail what the recommendations are. But I hope this has given you a flavor of the kinds of recommendations we're making. I think the bottom line is we got to move forward. We got to get going on this, and I hope the legislature is willing to pass some bills that get cesspools, priority cesspools upgraded with a way to finance it that doesn't burden the homeowners, and also takes advantage of new technologies where possible. So thank you for your attention today. I'm available for questions, as we all are, I think. Thank you.
Great. Thank you so much. Okay, we'll go straight into question and answer, and I think if it's okay with you, we'll start here and go there. And I'm going to save my questions for the end, since I know this subject matter probably pretty in-depth, and go first to see if any of my EEP committee members have any questions. Rep Woodson, go ahead.
Thank you, Madam Chair. May I please speak with Dr. Schuler? Thank you, Dr. Schuler, for your report regarding prioritization. You referenced that your data points were from 2009. I'm curious to see if there are any current or more current data points, and if that changes the geographic area of some of these prioritizations.
Yeah, apologies if that wasn't clear. So we started with the 2009 data. Then we took the Department of Health's wastewater database, updated to, I think it was 2021 at that point.
Okay.
Used some tax map key data, and then we also, did some geospatial analysis directly on the points, trying to remove kind of random outliers and whatnot. So our data points were updated to 2021. Yeah,
Thank you.
apologies if that wasn't
Thank you so
clear.
much for that. That's probably my mistake. And I don't know who can answer this question, but just quickly, Madam Chair, if I may ask one more?
Yes, please.
Thank you. And so, per the, there was some work done with regards to assessing emerging technologies, and I'm curious to know if there is any, was there any discussion given to see that if any of those emerging technologies would significantly reduce the price, because we're looking at potential catalysts and the cost is the barrier. And so if anyone can speak to any promising technologies that can bring down that cost, that can put us on a quicker trajectory.
Yeah, thanks. There are a lot of emerging technologies, including wetlands and some disposal technologies that also remove nitrogen. Some of them will be less expensive than some of the current options, and actually, I think Department of Health has approved a few pilot studies, right, where a couple have been installed or being installed in the state, so they can be evaluated to see whether they really work as well as promised. And so it's possible that some things can shift a little bit more towards the lower end of that cost range, but there really isn't it's not envisioned that there's anything that's really going to say these things are going to be like really inexpensive. But there's a lot of work also. VI, as Stuart's organization, is also looking at incinerating toilets and some other technologies, and that information's in the article that he mentioned, the Kapili Kai thing. So it's an evolving area. It's a great question, and I think one of the messages though that Ted mentioned is that we really can't wait. So we don't want people to get the impression that some magic thing is going to happen that's going to make all this stuff really cheap in the future, and so let's just wait 20 years to do something. We really have to get going. Emerging technologies are called that for a reason. They're not proven really at a large scale necessarily, and they would represent challenges in terms of trying to manage those systems and verify that they're actually going to work, for the long term and stuff like that. So hopefully that kind of answers the question.
Yeah, thank you, Doctor. Thank you, Madam Chair.
Great. Any further questions? Then I'll turn it to the Senate members, and then we'll go to members not on either committee.
Senator Owa, any questions? Okay, I'm not sure who this is for, but someone can step up. The ledge, we passed Act 153 and Act 183 this past session. Act 153 was a $20,000 grants for assisting low-income families to upgrade their cesspools, and I think we allocated $5 million. Does anybody have an update on? Has that money been released, and is that helping people? Sina?
Yeah, so it was actually, so the Department of Health is responsible for administering that grant program. Because it was actually a grant program that, so the Department of Health, it's actually something we actually have to form, like the procedures in providing grants, because it hasn't been done before in our department. So we're kind of hoping, so we've got like a lot of things going, but there were procurement issues with the act. So we actually had to get a exemption from Department of DAGS, and we're kind of hoping that it's going to be rolled out in the next couple of months. We do know that the funding doesn't lapse for 2 years, so but we just want to make sure that it's done correctly, because we don't want to give promises to these homeowners and not deliver. So yeah, but we are looking forward to that, and I just have to organize with my my office, because we didn't really realize too, we're probably gonna get thousands of phone calls, because there is a high demand, and this is like a $20,000 grant. So yeah, but we're hoping in the next couple of months.
It's $5 million, right?
It's $5 million, but then it's a $20,000 up to a $20,000 grant,
right?
For upgrades. Yeah, $5 million.
people at 140% AMI.
Oh, yeah.
below.
Right.
That's correct. And within the priority 1 and 2 areas.
Yeah.
And could you, Asina, could you also speak to Act 183, and that was the financing program through the Green Infrastructure Authority to help commercial?
So that one was actually through DBID.
Okay.
Yeah, so I don't have any information with that. Yeah, I don't.
Okay, anyone else here have that?
Probably when.
Yeah, Gwen.
Yeah.
Gwen would know that.
DBID,
Yeah.
okay. And then I had Dr. Roger. Sorry. We're all friends here, right?
Exactly, yes. Mike.
Can you, I may have missed it, but you were talking about the EVA project. You said that there were 500 cesspools out there,
Yes.
and that, can you just, when it started, what's your completion?
Yeah, so
information?
glad you asked that. So in Eva Beach area, in the older part of town, there aren't sewers. There's cesspools, about 500. So City County representing environmental services. So so that project, I guess, has been underway for a number of years. Planning would be completed, design is completed, and getting ready to getting permits and getting everything ready, and then hoping to award in FY24. We have I have $50 million budgeted for that. So if you do the math, that's $100,000 per home. That's because we're bringing in sewers to everywhere. But even at that point, it's not free for the homeowners. Basically, what the counties are able to do is to bring sewer up to the property line. What's on the property is the responsibility of the owner, right? We can't do that for them under our current sort of way we do things. By statute, that has to be done by the homeowner, and that could be $5,000 out of their pocket to connect from the house, and also close their cesspool. So they're going to need to do a closure process, which in general means that it's got to be cleaned out, emptied, and filled so that it couldn't be used again. So even that program's not free for the homeowner. It's much less than having, installing their own system. But whenever a county decides to do that, to put in new sewers, then ordinance generally says if there's a sewer there, you must connect. So it is a way to do it, but it's not inexpensive. And Eva Beach is relatively inexpensive because it's a fairly small area, so you can get a lot of cesspools all at once. And so anyway, we are proceeding with that, and evaluating the rest of the island in terms of where else we have opportunities to do additional sewering.
Great. Thank you, Roger.
Sure.
Thanks.
Great. And now, Rep. Martin, do you have any questions?
I do, thank you.
Yeah.
Dr. Babcock again. So I represent Waimanalo, and we have 2 neighborhoods there that are pretty compact, dense neighborhoods that are on cesspools, and I don't really understand the history of why that came to be. But how would I go about having those neighborhoods evaluated?
Yeah, that's a good question. So call me up and let's have a meeting, and I can find out all the history. But a little bit of the history is that the sewering was put in different times and different locations for different reasons and by different people. So, for example, Laie, right? It's a private system done by Hawaii Reserves. East Honolulu was by Kaiser, the developer, and they have their own separate system. There was a separate system, and actually the treatment plant that's there, Waimanalo Wastewater Treatment Plant, was actually built and operated for many years by the state, and then was taken over by the city later. What they decided to connect and not connect would have been a decision that would have been made a really long time ago. I can tell you that we do have evaluations and studies and a facility plan, for the area. I don't know where it falls in a priority. I don't see it right now as a CapEx project to do any further connections right now. But it is an area where there's impacts, and so we just need to keep moving forward and figure out where it falls on the priority of all the other things that we have.
Okay, thank you.
Yep, sure.
Great. Okay, I'll jump in with some of my questions, and Roger, you can stay
Okay.
where you are. I guess I have some questions about the cluster system option. So this
Yeah.
would be like a neighborhood scale solution to do like a smaller scale wastewater treatment system. I guess the first question is, you did mention it's maybe more expensive than people converting to individual systems if you take that cost and divide it, between homeowners. Presumably it would be a cost initially incurred by developers that would get passed on to homeowners when a new subdivision is built. But I presume it's also kind of in terms of the scale or the spectrum of how effective these different treatments are, like a better take a better system for treating wastewater than septic, especially in some conditions. So that's the first question. And the second question, and we have Ramsey here from County of Hawaii too, I'll just recognize. So if you want to jump in, we have other working group members. I think that's potentially a solution for some areas, but I would want the counties to be willing to take that on as part of their infrastructure after it's built. I don't think we can expect homeowners associations to effectively manage and maintain and operate one of these packaged treatment systems. So is there a process in place for that, or what do you have to say about that, I guess?
Yeah, so that's a good question. I'll try and do the first one first. A cluster system would be, very similar to our existing centralized systems, and so they require, certified operators, and they would have a permit with essentially requirements for treatment, and so for those reasons, they generally would perform really well. But at cost, right?
So
there's
more
a
expensive,
more
clean,
expensive,
but essentially cleaner.
Yeah, you're generally going to get better results, right? It also helps from a management point of view. There's less management to do because it's managing a system rather than a bunch of individual ones. So it can be very, very effective. And in some places, other states or other places, you basically would be required to do that as opposed to individual systems. You'd have to put in some sort of a decentralized system and construct it and then have it be maintained. The mechanisms for doing that are multifold, right? So a new development, that could be a requirement for getting the development approved, right? They say there's no sewer and we're not going to provide sewer, the county's not going to provide sewer, so you got to build your own. And that is one way to do it. And outer islands have a lot of that. They have a lot more privately operated wastewater treatment plants, much more prevalent there. With respect to sort of evaluating that, at least I can just speak for Honolulu County, so we are initiating a study to come up with essentially a cesspool conversion master plan for the island, and it will include all the different sort of components and how we finance that, either partially or fully or exactly how that's going to work. But we have to have numbers, to work with, and we have some prioritization and some schedule, and we do have a lot of priority 1 areas here. Not too many cesspools there, and there's lots of examples. I mean, I just was looking at an example the other day. We got a letter from a person who was notified that they have a cesspool. They're in Kaimuki. Okay, there are cesspools everywhere, not a lot, but we have some everywhere. And the house is pretty far away from from our sewer line. There's fairly big distance on their own property, and then it's not right at the street because it's in a cul-de-sac and it doesn't come for another 150 feet. So, the estimate they received was $150,000, to connect to our sewer. And so, what are we going to do? Right now, by statute, I can't pay for that whole thing. So, these are some of the things that, the reality is there's a lot of little things going on, and it's going to cost a lot of money. Even just to connect, I mean, this is a neighborhood, sorry, it's not Kama, it's in Manoa, actually. And so they're dispersed everywhere, and the question is, how do we assist and get these things done? And it's a pretty big, pretty big.
And then once I guess just kind of restating, I guess, that second part of my question, which you partially answered, assuming you overcome all these other challenges, and we do have a package treatment plant newly constructed that either a developer or private homeowners that are converting their cesspools pay for, but I think the issue is, especially for financing some of these things, is kind of knowing what happens with it after it's constructed.
Yeah.
Do you think it's reasonable to expect the county to take it on as infrastructure? I mean, I'll say I do, but I'd be curious to hear your response.
Yeah.
And
I would say,
I
yeah.
know that it will add costs, especially for, for example, Hawaii County already struggling with all kinds of other urgent needs in their wastewater system. At the same time, without that as like the end result, I don't know if it's much of a potential solution for anybody. If the county's not willing to say, once it's built, this will become part of our county infrastructure. Like when you build a new development and the roads and sidewalks
Roads,
eventually
yep.
finish the checklist, and then it gets executive ordered over to the county.
Yeah. So no, we have a history of accepting treatment plants and collection systems. And you're right. It's exactly like the roads, the drainage system, and the existing sewers. So in a new development, all that stuff gets put in. It's built to our standards, and then we go through an acceptance process, and we take it. So the same thing is definitely possible with treatment plants. It would have to be up to snuff when it was completed. Sometimes that works really well, and other times it doesn't. I don't necessarily want to throw anybody under the bus, but Latye treatment plant, we've been operating it for maybe almost 20 years, and it still has not come to us for various reasons. That transfer has never been completed. We operate it and do everything.
Outstanding checklist items, is that?
Yeah,
Interesting. And then, can I put
Yeah,
you on
please.
the spot, Ramsey?
No, that is fine. It comes to the same question. Yeah, it comes with challenges. It depends. You could dedicate a brand new facility, but if the community is small enough not be able to subsidize the O&M costs, which is operation and maintenance, so you expect other areas to fund it, unless you put everybody under the same sewer service fees. So they're gonna end up paying, the same amount of sewer fees, but it may not cover the O&M cost, the actual O&M cost. Plus, it's gonna require a certified operator that we lack within the state. It's hard to find any certified operator. So let's say we have decentralized, clusterized package units, especially on the Big Island. If we're gonna take every subdivision that comes in and build a package unit, we're gonna be like the Starbucks of the country. We're gonna have it at each corner. We're not gonna be able to have enough operators to operate all these facilities. So it makes sense to either create home association, let the home association deal with that particular treatment, unless it's large enough that could connect to the county system, and it makes sense. But to try to get it from every subdivision, it's gonna be overwhelming, just for the county to take over from regulatory point of view, from operation point of view, and from cost as well. Hopefully that answers.
Do you think if we were, that still seems like a solution to me that makes sense, even if it means that before we can get there, we have to really build up capacity at the county
Well, we have to build up capacity at the county,
and workforce.
and the workforce. As you know, we have 7 waste treatment plan, and as you know, also we need almost $1.5 billion just to bring these facilities up to date. We're in the process of finalizing the Gila treatment plan, where Corolla is doing the design. We're looking at $200+ million just to rehab an existing facility. We only have about 5 operators for the facility, plus they oversee the country plan. So we stretch and thin on finding certified operators. Unfortunately, it's fact. Probably you have the same challenge. So we've been advertising. Nobody's applying. It's a crabby job, literally crabby job, like Senator Gabbard said. So it's a challenge. And to take on more where you cannot actually provide and achieve the proper maintenance and operation and meet compliance, it may come back and bite the county. So we need to do something. Either has to be private-public partnership and somehow or another, so we could, team up with them and trying to provide the service that everybody, our constituents, look for.
Oh, sorry, Senator. This is Ramsey Mansour, the Director of Department of Environmental Management from Big Island.
On the Big Island. Thanks.
Sorry, and also a member of the working group. And for everyone else, sorry, we just called you up here very informally. I apologize.
That's fine.
I guess, thank you. And Dr. Schuler, I have a question for you. Do you envision, is there any plan or even a need to sort of update the prioritization tool as new data becomes available? Or does that feel kind of redundant, like we've established what the highest priorities are that will carry us forward into the future, and inevitably all the cesspools have to be converted eventually? Or do you think there'll be a need to update it, which might mean a homeowner that was previously in one priority area moves to a different priority area, which I think it raises other questions. So what do you think?
Yeah, absolutely. And this might be a better question for Sina as well. We built the framework to be modifiable and updatable. The question being, when does it make sense to do that? Currently, this prioritization is being used for the $20,000 grant program that was mentioned before. And so, perhaps it makes sense from a management standpoint to update the framework when, new programs are established, or this prioritization just becomes outdated. But yeah, Sina, do you have other thoughts about when it would make sense to update the prioritization?
I think the report that you guys provided was kind of substantial, and they did a deep dive in like a lot of the factors, that would impact the cesspools impacting the environment and health. If you ask me, I don't really see that there is going to be a lot of changes and updates to the prioritization, because there was like a lot of work done in prioritizing it now. I mean, there has to be something that comes up that we didn't even like study or know about, that would impact the prioritization. But if you ask me, today, I don't really see any kind of significant updates anytime in the near future.
Okay, thank you.
And can I just take this opportunity also just to put in a pitch? I did mention we only had data for the 4 main Hawaiian islands. And so we've been talking with Department of Hawaiian Homelands quite extensively about extending that to Molokai. It would require a kind of a new assessment, but there's some legislation that will be introduced in this session to actually do that as well. So it can be expanded certainly to cover other islands.
Thank you. Yeah.
Yeah, and thank you. And about prioritization, I remember first hearing, I'm Rep. Cochran from Maui County and House District 14, which the head of, it's pretty much all of the head of Maui right now. And a lot of the high priority number 1s are in my district, I'm noticing, which rightfully so, it's along the coastline. And so it's nice to see that most of the calls through my office when I was a council member for 8 years was the conversions in the upcountry area. Like, we're on Haleakala, it's not even near groundwater, why? So I'm glad, that it is priority 3 in that area. But I'm looking at all the reds that are dotted all over the Lahaina, West Maui area. And I know Eric Nakagawa from Department of Environmental Management on the county level has been on the working group. So just wondering, what have come out of the working group in reference to, these high priority areas of West Maui. If there's anything, is that in the report? If I went online and went to the cesspool tool, will there be more, details there to find?
Yeah, I think certainly the report has more details, and I think maybe kind of the a key part of your question is, Upcountry Maui was designated as priority 1 before, and then our tool listed it as priority 3, right? And so that arose from just different sort of ways that prioritization was put together. So our tool actually didn't consider any water quality data. Because we compiled all the water quality data, we looked at it, we tried to fit it in, and when it comes down to it all, there isn't a cohesive blanket of water quality data that can be compared apples to apples across the state. There's studies here, there's studies there. Bob Whittier did the study in Upcountry Maui that made that listed as a priority 1 area, and that was specifically targeted towards drinking water quality. Our prioritization took drinking water quality into account. We had 3 factors in there that were weighted fairly high because drinking water is really important to all of us. And those were input into the calculation, but there's so many other factors in there as well that actually brought that number down. So, again, the prioritization that we put together was, based on essentially this, calculation framework. So, we didn't necessarily make decisions, or, we weren't really able to, nudge the outcomes of it at all. So when it came to those areas, there were some priority 1 areas that ended up not being priority 1 in our assessments. And one of the things that we did mention in our report was if it makes sense for those to be, administratively changed to priority 1 areas, because there's special information like this particular study that was funded by Department of Health in Kahalu or in Upcountry Maui, then that may make sense. So again, our prioritization is just a starting point for that management plan. Does that kind of answer what you were wondering?
Yeah, a little bit. But I mean, we've been through our wastewater treatment plant in West Maui, lots of upgrades due to the litigation that had occurred and things. And I'm noticing where all of these red dots are located, they were once probably built by the plantations and then transferred over, roads and sidewalks and what have you, but they're still cesspools. So they never were connected to our municipal wastewater treatment facilities. So coming from county, I can definitely work with them and see how we all can partner. We need to partner. This is a partnership, has to be. Not one entity can take care of the funding. But I'm happy to hear about the increased building up on the workforce, because that's so important, and to, entice people to want to get into this job, this brown job, green job. And I'm not sure if any relationship to what Kahului Airport has done, where they've just created their own within sort of maybe a package plant, I think, of sorts, where all their wastewater is kept on site, treated, and then reused in their agriculture. I mean, everything stays on site, what's created at the airport in Kahului. So, I mean, that could be a great example, I think, of how other places can see how they've done that. And it sounds very successful, and probably something that can be, looked at as a resource. So, I just basically want to say thank you for the presentation and the report.
Cool. Thank you, Representative.
I have a final question. Hopefully, oh no, go ahead. You first. Okay, for I think Sina, Department of Health. And yeah, please come up, because then everyone on YouTube can hear us. I think in Roger's presentation, they talked about, he went over department approved systems, and seepage pits was on there. And I think injection wells, and this kind of came to mind because you brought up Lahaina. I mean, this is a little bit just adjacent to the individual wastewater system issue, but I think another big looming issue that we're going to have to deal with. I mean, where is DOH thinking about that in terms of action on injection wells and seepage pits, which I think could potentially be running, some of the things could be kind of running afoul of federal law at this point with the court decision. So where are we with that?
You want to answer that? Yeah. I'm gonna probably have Joanna Sato. She's our
Yes, hi Joanna.
yeah,
Joanna,
she's
you're
our
hiding back there.
environmental
I didn't see you.
management division.
Morning, chairs.
Hi.
The Clean Water Branch is responsible for the National Pollutant Discharge Elimination System, and they are in the process of reviewing a draft document for a permit, which uses the criteria delineated in the Supreme Court case to determine whether the discharge from the injection well meets the functional equivalent of a discharge, needing an NPS permit. So we are in the process of it. We have not yet gone out of the department to provide this draft to anybody.
Okay, but it's being worked on.
It is being worked
And then
on,
I guess
yes.
on the seepage pit question, I mean, it may be listed as an approved technology, but but not as a cesspool alternative, I hope. Are permits being issued for seepage pits?
So
Or seepage?
They are. I mean, but it's because like a lot of homes are constrained size. You know, some of them are like 3,000, 4,000 square feet, right? And then if they're wanting to like upgrade their cesspool, what is that? They have no place to put a leach field. So, you know, we actually have to approve of a pit, because if we don't approve of a pit, they have like no other alternative.
Right.
But and the issues with seepage pits, especially if you're close to the ocean, is the groundwater, you know, and that's the same thing with cesspools. Everything that goes in a cesspool near the ocean, high groundwater, it just gets discharged into the groundwater and then it flows into the ocean. So when it does directly discharge to like a seepage pit that's in groundwater, we require a variance, but we also require the highest technology that is available, where it's a robot treatment unit that actually does at least a 50% nitrogen reduction. We also require them to put a UV disinfection system. So those are all kind of like, if we do approve of it. I mean, in my office, my engineers are always like looking and making sure that, you know, absolutely, we try not to approve of pits unless it's absolutely the only alternative that they have.
Okay, because I saw it on the list and I was like, really? That's like on the PowerPoint, it was like, here's an alternative.
Yeah, but we also, I mean, going back to like the injection wells, so like even new injection wells for treatment plants that are actually located like, you know, near ocean, there is, I forget which act it was, where it actually prohibits new injection wells if there's actually no alternatives that are available. So when we look at new treatment plants, and a lot of them, they're putting in these new package plants like on the Big Island. That's actually where a lot of the construction, a lot of the new subdivisions with the private plants. So we actually are looking at it, and we're really trying to promote water reuse as the first method of disposal. Reuse, and then your backup is not going to be an injection well. You know, we're looking at like a soil aquifer treatment system. Something else where you just don't inject it into the ocean, even if it's a backup. You know, we want some kind of treatment as a secondary, but for primary, we really want to promote water reuse. And I think that's probably one of the things with our department, you know, with trying to just minimize pollution to the ocean, with at least these new treatment facilities that are so close to the ocean, is to try to require water reuse as the first primary disposal, and then something other than an injection well as backup.
Thanks. Yeah, and that kind of brings to mind that, just to say for everyone listening or watching online, that we didn't talk much about exemptions today, but that was part of the working group report and discussion, and we understand that in some cases there are needs for exemptions, so that is also in there. Go ahead.
Last thing. Ted, could you come up? Ted, you mentioned, and a couple of the other speakers mentioned about the public education part.
Yes.
Was that part of the working group in the report in
Yes,
terms
it-
of the strategy to get the word out, the urgency of what we're dealing with here? I mean,
Yes.
53 million gallons every day going
Right.
into the groundwater.
Right.
I think, you know, a lot of people don't know about this, right?
Yeah.
So, go ahead.
I think the working group, in talking to other jurisdictions, realized that outreach was very important in terms of making the program ultimately successful. So other states or counties that have done big projects over time, projects take a long time. And the successful ones tend to have had an outreach program that's robust and gets people's opinions in advance, and then also make sure they know what's going on. So yes.
Then PSAs, online stuff, all the.
Yeah, I'm not sure of the details of it, but I will answer your question by saying that outreach was a big part of
Okay.
the working group's study.
Okay, thank you.
Thank you.
Yes. Sure, Stuart.
As part of the working group, we did look at other states, and there's an article we can send you that New York Times yesterday really featured Massachusetts and the issues that they're having with nutrient pollution. Like their whole industry, shellfish industries, have collapsed, and with sea level rise, there's all kinds of water pollution and serious issues that are going to be associated with this. But I think in Norfolk County, Long Island, which is the only place in the country that has more cesspools than Hawaii in volume, we have the most per capita. They worked with communities at this federal, state, and county level, and really got on the same page, and it was all about public outreach, because people rightly are kind of like, how much money do we have to spend? This is crazy. I've been going down a cesspool all these years and no problem. Well, no problems for you maybe, but down the line, there are problems. And so, but when they showed the results of nitrogen pollution in their drinking water, in their coastal waters, they really came around. And so I think, if we could, bring some of those out. We're trying to bring some of them Suffolk County, because they're really a model. They've been working on it for 15 years, and it's very successful. That might be something that we can do a presentation for the legislature right around the time of the Pacific Water Conference, which is early February. If you guys are interested, we could help set that out.
Yeah,
Thank you,
let us
Mahal.
know. All right, I
And
think.
sorry, lastly,
go
we're
ahead.
composting toilets, or that ever talked about or looked at?
Yeah, composting toilets are possible. They're in the report. Generally, it's possible, but it's not for everybody. It's not for most people. There's a very hands-on component required with using a composting toilet. I did want to add one thing though that Stuart said. One of the things that's really successful about Suffolk County is that they have 2 grant programs. There's a state grant available for $10,000, and there's a county grant for another $20,000. So that's free money. That's what a successful program gives everybody $20,000.
Great. Okay, I think we're 2 hours in, so we're gonna, any additional questions any members have? I know members were here that had to leave, but you can email to myself or Senator Gabbard, and we'll pass them on. And I want to say just a huge thanks to the working group members here and those who might be watching online, and all the contractors and people from UH. This was really a massive effort over 4 years, and now it's time that we take all these words and put them into action. So we'll be talking about this a lot this session, and we're going to count on Stuart for all the wastewater jokes that are sure to come with it. But just thank you, everyone. Mahalo.
Thank you. Mahalo.